Welcome back to this special edition of Regionally Speaking on Lakeshore Public Media. I'm your host, Dee Dotson, and we're continuing our conversation about a crisis that hits home for every neighbor of the region. We're talking about inside the fentanyl crisis in Northwest Indiana. Joining us in studio is Alfred Chip Cooke, the Assistant Special Agent in charge of the Drug Enforcement Administration's Merrillville District Office. In our first segment, Chip, we talked about the big picture, pipelines and federal and local surges. But for a parent in Valparaiso or a teacher in East Chicago, the big picture doesn't matter as much as the phone in their child's pocket. So I want to talk about the most vulnerable part of this equation, and that's our youth. And I want to start with this, ASAC, Chip. So the other day, I was just mindlessly scrolling through social media just to take my mind away from all of the news that I cover. And I ran across this reel, and I'm not certain if it was because I was preparing for our conversation today that this particular reel came up, but the reel actually reminded me of something you said in the first part of our conversation. So the host or the speaker or influencer of this reel was a healthcare provider who worked in an ER. And he began to share with his viewers, recounted a recent story of the sad, unimaginable, untimely death of a young man. And he began to tell a story of how this young man, 19 years old, by the way, was brought to the ER by his friends, who sadly passed away. But as he began to tell the story, he spoke about the young friends hanging out earlier in the evening, just hanging out as kids do, and they were vaping. But what he said as a warning to parents and anybody is that what these young kids did not realize is that the cartridge that they used was imported from China. And we spoke about this in our first segment. And they did not realize that it was laced with fentanyl. And then he went on to describe, just as you did in our first half of our conversation, that the amount of fentanyl that was in this cartridge, as you just shared, was the size of a tip of a pencil.
Good.
And when he said that, I literally stopped in my tracks because I said, oh my goodness, oh my goodness. But what was really powerful for me in this conversation is that he said, unfortunately, this young man did make his transition, but what was so difficult for him as a healthcare provider was having that conversation with his family. Now, I'm the mother of 5, as I told you offline, and I have a son that's in that age range, and I cannot imagine anyone having to share that tragic news with me. I just cannot imagine it whatsoever. So I want to talk to you about, you kind of spoke about this a little bit earlier in the first half of our conversation about the campaigns that we saw in the 80s and the 90s regarding combating drugs. And I thought to myself, the just say no drug era is over. So I want to ask you, how should Northwest Indiana parents frame the fentanyl conversation in 2026 so that they do not lose the attention of their children?
Wow, that's unfortunately, that is a story that even in my role, I have heard countless times, and that's just me.
Yeah.
All of us in the office are at some point throughout the year doing some sort of prevention. We meet a lot of people, a lot of families. There are some really close call stories, people who have overdosed and they've been brought back through Narcan or recovered from addiction and substance use disorders. There are some obviously very tragic stories like that one. Yeah. And I won't say who they are because it's not fair, but they're both very public about it. But I'm aware of 2 families, one in South Bend and one here. Aware of more than 2, but the 2 that we really connect with a lot. Well, I'll say the one here is Patty Stovall, and she runs the Sounds of Sarah organization. And she went through just this, not with vaping, but with her daughter, Sarah, overdosed and tragically passed away from cocaine laced with fentanyl, right? And the other family is from South Bend, not vaping, but it doesn't matter whether it's vaping or it's cocaine laced with fentanyl, which, as a side note, we have to be very aware that cocaine and fentanyl are a thing. And we could do a whole nother half an hour or so just about cocaine, but cocaine, not good, not good.
Right.
But whether it's cocaine laced with fentanyl, counterfeit pills, right, the counterfeit Adderalls or Oxys, or vaping with chemicals coming again from China, it's all horrible. It's tragic, and enforcement is in our name. We are the Drug Enforcement Administration, and I referenced this earlier. We also have a deep sense of empathy for these people, and I think of Patty Stovall in particular, the tragedy of losing a daughter to fentanyl and cocaine, but the success that's come out of that, and she started this organization, and they're having just fantastic success on the messaging front, and that's really what it comes down to. At the end of the day, people have free will. People are going to make their own decisions. You hear all the time the brain really isn't even completely formed until about the age of 25.
Right.
So clearly an 18-year-old, let alone an 18-year-old who might be drinking, an 18-year-old who might be using marijuana, their judgment is completely off. Yeah. So those are tough situations, but hopefully the messaging that parents, don't be afraid to talk about fentanyl and drugs with your kids. There's no stigma. That's probably one of the biggest irks that I have.
Yeah,
right, good. Is they think if I talk about drugs to my kids or with my friends or my family, or maybe there's somebody in my family that has an issue with drugs, scarlet letter, the stigma is out the window. That is so 19 whatever, right? That does not exist anymore. We need to be screaming from the rooftops. And I have children. I talk with them all the time. Even though I'm a DEA agent, does not mean that they are immune from being pressured into situations. Yeah. And they know not to. They have that exit plan. They are my kids, and I think they're pretty well messaged to stay away from this stuff. But the stigma of having these conversations with your children and with your students, if you're a teacher, or with your patients, if you are a pediatrician, talk about it. Because the reality of it is so many people have passed away. So many people are continuing to pass away from fentanyl. 50,000 Americans last year died in the United States, 50,000 Americans from drugs linked to synthetic opioids, which is fentanyl. And if you do the math on that, Dee, that's about 136, 137 Americans a day. That's like a 737, somewhat almost filled 737 airplane going down a day. Yeah. So we need to have these conversations. Do not be shy. Do not be scared. Do not feel, there's a stigma. No, because by planting that seed, by having that message to your kids, and again, the age range 18 to 44, the number one leading cause of death is drug overdose. This is the target audience. We have to be messaging this to our kids.
Absolutely.
And no organization, whether it's a government organization, whether it's a nonprofit, whatever, nobody should be pushing back and saying, we don't want to talk about that. Well, that's behind the doors. That's behind the curtain. No, we don't want to. No. That is probably the biggest mistake. Yeah. So messaging and having those conversations, as cheesy as it sounds, right? Yeah. Have that conversation. It's actually true. Because that conversation works, and you plant that seed. And then in the future, when that 18, 19-year-old kid, young adult, is presented with the situation to do vaping, maybe, even though that individual maybe was drinking or not, maybe that seed that was planted through that messaging will illuminate in their brain, and they'll go, boy, these chemicals do come from China. Yeah. And, that's the other thing, too. We know that the fentanyl issue is a matter of public safety. Yeah. There's violent drug trafficking, violent crimes that are associated with drugs. We know that it's certainly a public health issue. We talk about all the people who are dying. But what we don't really talk about a lot, and this is some of the role of DEA, And it goes back to China, it goes back to Mexico. This is a matter, whether it's drug dealing in Northwest Indiana or regionally or nationally, this is a matter of national security.
Yeah.
We have foreign countries, China, Mexico,
Yeah.
Colombia, Peru, and Bolivia with cocaine, who are directly, not indirectly, who are directly, affecting the lives of Americans.
Correct.
And for us as DEA, we're the federal agency. We're charged, tasked, funded by Congress to do these things. We love pushing the message that, yes, drugs are affecting us here in Northwest Indiana, but think globally. This is a matter of national security.
Yeah.
And we have these foreign countries who are turning a blind eye, and these cartels who are just fine when that young 19-year-old kid in the hospital overdoses and dies. China doesn't care.
Yeah.
The cartels in Mexico, they don't care. They're all about making their dollar. If they made their sale off of that cartridge, for them, that's a win. That for us is a matter of national security. And for me, I think that should be a huge wake-up call. It is for me, and certainly for the residents of Lake County. This is a matter of national security.
Absolutely. That was, as I'm listening to you, that was powerful. You positioning one airline going down a day to actually having those communications with your friends and your neighbors. Because if we had one airline going down a day, you better believe that that would be a conversation that would be top of mind.
Yes, that is 100% correct.
Yeah.
And, let's just go back to Lake County. Just one more on that.
Yeah.
The numbers that we have and that I've seen in 2024, there were 156 Lake County residents who died from drug overdose. Again, that's like an airliner. If an airliner of Lake County residents went down once in a year, that would be the biggest story we'd be talking about forever.
Forever.
Well, that is what's happening, but it's person by person by person, all thanks to drugs, and then certainly thanks to fentanyl.
Yeah.
We, the media, thank you very much again for messaging this for us. Law enforcement, we need to continue to talk about this and keep this not out of sight, out of mind, but certainly in the minds and thoughts of everybody.
Absolutely. So, Chip, dealers aren't just on street corners anymore. They're in DMs, and we were speaking about this earlier. Can you explain the emoji code that parents need to watch for on social media platforms such as Instagram, Snapchat, and TikTok?
Right. And with regard to those emojis, they have a variety of emojis that are used to sell drugs online on social media can be found on our DEA.gov website.
Good.
And you always have to push the website. I think that's very important. But this is part of our Fentanyl Free America plan, is to make sure the community knows that we are supporting them by having these resources that are out there. So with regard to the emojis, again, that you can find on our website, it's all about evading law enforcement, but maybe if you're a young adult, evading your parent because you're a middle schooler, a high schooler. Your parent, might be grabbing that phone to see what you're doing.
Right.
So what's a great way to talk about buying counterfeit pills or to talk about buying marijuana without your parents realizing? Because sometimes parents don't always know.
That's true.
So let's throw out there some crazy emojis that we all know within our inner circle means Adderall.
Yeah.
Means weed, means whatever. So, and the problem is there's not just like, oh, here are the 20 emojis and that's it.
Yeah.
There are always new emojis.
It's always evolving.
Right?
Okay.
So as a parent who has access to the phone,
Yeah.
because you're paying the bill,
Right.
right? They're a juvenile.
Remember they're paying.
Right? You're paying the bill, you have access to that phone.
That's true.
But work with your son or daughter as well and say, I want to see your phone. And when you see certain emojis that just don't make sense, again, that's where you have to ask.
Yeah.
But yes, that very much, if you see something, sadly, that could very much mean, hey, there's something going on here that might be harming and hurting my kid that I got to get to the bottom of.
Yeah.
Not as much for educators. Your teachers can't be going through your phone.
Right.
Right.
Yep.
That's a search and seizure Fourth Amendment issue right there.
Yeah.
But certainly for the parents, just know that emojis are coded language,
Right.
and it's all about really for the individual, the kid, not evading law enforcement. It's more for evading the parent, so that they don't know what's going on.
Absolutely.
But great point, and thank you for bringing that up, because that is really important for all of us to remember.
Right.
That coded language.
Yeah. Because we may think that's a cute little message, or those cute little smiley faces, or whatever the emoji is of 2026, whatever the latest emoji is. And so I'm so glad. I wanted to make certain that we touched on that. So another thing that we touched on earlier, you touched on earlier when speaking about students, about this immense pressure to turn to what they think are study aids like Adderall. Unaware, as you shared in the first part of our conversation, but unaware that they are counterfeit pills. So how can parents and educators identify a person who is struggling mentally, and we spoke a bit about seeking mental health or help from your pediatrician or whatever, versus one who is experimenting with counterfeit pills?
Well, and with this one too, I have to mention, because it is a trend that we are seeing, and it's super important. And specifically with regard to Adderall. Okay? And again, we know Adderall is legitimately prescribed. People, have study issues and getting through tests, and that's if it comes from your doctor and the whole thing, sure.
Right.
But what we are seeing specifically with counterfeit Adderall pills right now, and again, this all comes back from Mexico. It all comes back from the cartels, Sinaloa cartel and the Jalisco cartel. All of these counterfeit, I say all, but let's face it, it's like all of them. The counterfeit pills that somebody would buy in the college dorm, somebody might buy in the cafeteria of the high school, and they think they're getting Adderall. It's methamphetamine. And methamphetamine is a central nervous system stimulant, highly, highly, highly addictive. And the Mexican cartels are the absolute experts when it comes to meth production, meth manufacturing, meth trafficking. And they are not stupid. They want their dollar. They want people addicted to these. So let's throw out. We know, we know America. There's a lot of Adderall use out there.
Right.
Okay, fine. Well, it's all about marketing, and they're a business. So let's make these pills meth to get these individuals hooked even that much more. So I just want to mention that specifically with study aids.
Yeah.
Again, if somebody needs Adderall, super, super important, just even that much more.
Yeah.
That doesn't even include the methamphetamine that's then laced with fentanyl. So, okay, maybe you just get an Adderall pill that's really methamphetamine, and now you're hooked. Or now you get an Adderall pill that's actually methamphetamine that has the 2 milligrams, the lethal dose of illicit fentanyl, and now you're dead. So, the pediatricians, my brother-in-law is a pediatrician, and we've had discussions about this.
Good.
The importance of bringing in that conversation with your health professional. Good. There are no secrets. Pediatricians have seen and they've heard it all.
They've heard
right?
it all.
You got to bring your child's pediatrician or your doctor into the conversation. And certainly we know that the educational systems, they're all over this. I don't know for sure, but I do believe that the state of Illinois has actually enacted law that they have to include some sort of fentanyl awareness education into their school system, into their annual curriculum. Don't quote me on that. I know I just said it on Lakeshore Public Media, but that's my memory seems to recall it. But if that is the case, and I think it is, I love that.
Good.
I love that an educational system is actually openly willing to talk about this.
Yeah.
Again, it's not a stigma. There's no parent, no politician, no educator should be afraid of speaking openly about the dangers and the perils of fentanyl. And back to our one pill can kill campaign.
Yeah.
One pill can kill, and we've seen that time after time again.
Yeah.
One counterfeit pill.
Yeah. Continuing on the conversation about schools themselves. So there has been significant debate about stocking naloxone, I hope I said that correctly, in schools. So from your perspective, is having Narcan in every classroom a necessity in 2026, or does it does it risk creating this false sense of security?
We love naloxone. We love Narcan. It is a proven tool of saving lives. But to answer your question, Dee, and quite frankly, I'm not an educator. I've never worked in the school system, and so I'm not. My degrees are not in education. I'm a little hesitant to really suggest that schools should. I think that's a question for them.
Okay.
But from the enforcement side and even on the prevention side, and we know that naloxone and Narcan work. So that being said, I think the umbrella answer to the question would be, we'd like to see Narcan everywhere. I have Narcan in my car. I mentioned earlier the Sounds of Sarah organization. They hand out Narcan like nobody's business. So
really,
we want to see everybody carrying. Well, and again, it's a personal decision if you want to carry Narcan, because you have to.
Yeah.
If you have to administer Narcan, it's not pretty.
no, right?
It's not like, hey, here's some Narcan in your like. It's
glad
an
you
ugly.
shared
It's a
that.
tough situation.
Yeah.
But I think in particular, I'm drawn to South Bend, and I'm drawn to the St. Joseph County Jail in South Bend. They have a vending machine full of Narcan
Wow.
in the lobby of the jail.
Wow.
So that I love, because if you're struggling with substance use issues and you've been incarcerated and you come out, maybe the first thing you do, and by the way, they cannot keep enough Narcan in that vending machine out there.
Wow.
So maybe the first thing you do is you hit up that vending machine and you grab some Narcan before you leave, or the community can always go in and grab Narcan as well. So
Interesting.
I can't really speak specifically because it's not my area about schools.
Okay, that's fair.
However, it's a proven tool. We do promote it. DEA does promote the use of naloxone, and we suggest have it out there as readily available as possible. Maybe have it at the malls. Maybe have it at local fire departments,
Yeah.
police stations. Are great places, places that the public knows that they can go. I think the library actually would probably be a good suggestion.
Oh, that's actually
Go to
an
the
excellent
library and
suggestion.
you can get Narcan.
Yeah.
And again, I just it's a publicly accessible place.
Yeah. And the important point, as you were sharing that, is you can get access to those vending machines in St. Joseph County without fear of facing sort of being charged or being questioned by law enforcement. I can't think of the word that I want to see. So that's really, really great, because sometimes people may say, oh, if I go into a police station, a jail or whatever, and I access this, I may be followed by law enforcement who will say, wait, what are you doing? What are you getting? So that's good.
On that, and we have a program that we run twice a year, and it's called our Pharmaceutical Take Back Program, and the next one's coming up on April 25th. And we work with our state and local counterparts, and they all have, essentially, they're like big mailboxes that sit in the lobbies of their police departments. And for your unused, your expired medications, oxycodone, Adderall, whatever, you can go inside the police department to their mailbox and drop in, no questions asked, a bag or a box of unused and expired medications. So, you're right. It works. That is a super successful program that DEA has been doing with its partners for, my goodness, I don't even know how many years now, forever. So if you can walk in and dispose of unused, expired pharmaceuticals with no threat, the same theory would apply, certainly for a vending machine with Narcan.
That is awesome. ASAC Chip, I want to say this, beyond the phone, or ask you, I should say, beyond the phone, what are some of the physical signs of synthetic opioid use that a busy parent might overlook until it's too late?
You mean like the physical signs? Yeah. So fentanyl it's a synthetic opioid. It's not a central nervous system stimulant, right? We think of methamphetamine and cocaine. It's a stimulant. You're agity, a lot of energy. You're kind of bouncing off the walls. Fentanyl, heroin. These are opioids, so the system tends to almost shut down. Breathing struggles, heart rate shuts down, sweating, maybe a loss of a sense of reality of where you are. So I think that's like a huge sign. If you suspect somebody, a loved one or a family or a friend is struggling from fentanyl or heroin, any sort of opioid, oxycodone as well, look for signs of like going from like fourth gear, if you're driving a stick shift, fourth or fifth gear, down to like 1 or 2.
Wow.
Right?
That's a good visual.
Somebody struggling with fentanyl and heroin and oxys are not going to be bouncing off the walls that like somebody with meth or cocaine would.
Wow, I'm glad that you shared that. So in the first half of our conversation, we spoke about your collaborative efforts with law enforcement officers across the state and across the Midwest, for that matter, and how those are working and benefiting the mission of ending fentanyl use in our communities. But I want to ask you about other community stakeholders, because I do believe that those are vital to educating and informing as well. Is the DA partnering with churches and or youth organizations, which I believe are the backbone of our community, to reach kids who might not get this information at home?
Yeah. Again, I very much love that because, and I said it earlier, I think I did, enforcement's in the name of our organization. We're the Drug Enforcement Administration. And we've been around since 1973, but since 1973, we've actually had a very active prevention component. And I think in particular about Red Ribbon Week, which happens every October. That's our premier prevention event when we connect with a variety of stakeholders, as you said. It's not just schools, it's healthcare, community organizations, churches across the nation, and even here in Northwest Indiana, we've definitely done a substantial amount of this. And just working with those nonprofit organizations. And Lake County has a drug and alcohol coalition program. It's called SAFE. We work with them.
Wow.
But I think about our Red Ribbon Week in particular. It happens every October. It's primarily focused on schools. Okay. And it goes back to the 1985 kidnapping, torture, and murder of our hero, Special Agent Enrique Camarena. He was in Mexico, Guadalajara, Mexico, and went through this horrible, horrible ordeal. He was kidnapped in February of 1985. We didn't find him until March of 1985 in Mexico, and he remains our hero. And out of Kiki Camarena's, Special Agent Camarena's death, DEA established the Red Ribbon program, which continues today. And it's all about drug prevention. And his family was such an important part of this. And his family still to this day, that was 1985, still to this day, his family and DEA, we are one, And that is our biggest premier, the one as DEA within the agency, the one we love the most is our Red Ribbon Week. Yeah. Because it is all about getting out to schools and the community and saying, hey, please be drug free. Here are the perils of drug use. These are the reasons not to use any type of drugs. But also, for us, every year we get to celebrate Kiki Camarena. And that guy was a hero. Yeah. That guy, he is our poster child when it comes to who we are as DEA as an agency. We go to work every day because of the Mexican cartels.
Yeah.
And the horror that they brought to him, his family, and to our agency and to our nation. So Red Ribbon Week is usually early to mid-October.
Okay.
And that's one for educators to really look out for. And even locally here in Northwest Indiana, if you're a school, even if you're a hospital, any sort of healthcare facility, and you want to do something with Red Ribbon Week, call us. Let us know.
That's good.
Find us on social media. Call DEA Merrillville, the district office. Call DEA Fort Wayne. and we will help you coordinate, implement program, and bring a prevention program to your organization.
That's good to know. Chip, looking ahead over the course of the next 5 years, if the two of us in our conversation today, if we are successful with our outreach efforts, what do you hope the drug landscape of Northwest Indiana will look like, again, 5 years from now? Can we actually educate our way out of this crisis?
Fentanyl free.
Good.
That is our vision. That's our goal. And we're very optimistic that nationally, and again, the national numbers and the Northwest Indiana numbers very much mirror. We are so optimistic that we can be fentanyl free, which translates to lives being saved. The numbers continuously, annually, are declining at significant amounts for overdose deaths. Even the purity, we have a fantastic forensic science program at DEA. We have a national lab. We have labs spread out throughout the country. Our regional Midwestern lab sits up in Chicago. We are seeing a significant decline in the purity of fentanyl powder, really. Traditionally, the purity of fentanyl powder has been about 20%, and now we're already down to 10%. So that's fantastic. And even back to, and I know we've talked, Dee, a lot about counterfeit pills, back to the counterfeit pills. I think back in 2023, 76% of the counterfeit pills that we were seizing had a lethal dose, those 2 milligrams or more of fentanyl in them. Well, last year, in 2024, into 2025, we're already down to 29% of pills that we're seizing have the lethal dose. So all of these numbers, lives are being saved, purity of fentanyl is decreasing, the amount of fentanyl that we're finding in counterfeit pills, which is driving a lot of these deaths, that's decreasing. The messaging is increasing, the partnerships are increasing. Our vision, we are optimistic as can be, and you need that passion for the vision, and you need to have optimism that we are going to be fentanyl free. And quite frankly, and I actually think about this a lot, Dee, we're not crazy when we say that. Somebody has to do this. If we don't keep driving the message and keep driving down all of this, it will flourish. Yeah. So we're going to keep pushing away because we see a very positive end in sight, and we see lives of Americans being saved. And why would you not push on that? That is the end goal, and it's fantastic. That and the complete crushing and dismantlement and destruction of the Mexican cartels, which we now call foreign terrorist organizations,
right?
Which we're going to crush them as well. Mm-hmm. That's the beauty of it. They have no idea. We're already completely. We're having so much success against the cartels. This is globally, but that and a fentanyl-free America, we are going to get there, Dee.
Yeah, absolutely. Chip, I feel like we're friends. I cannot thank you enough. We cannot thank you enough for coming into our studio today and for this candid, life-saving conversation. The information that you shared, I know, will save many lives in Northern Indiana. For everyone listening, again, we want to encourage them to please visit dea.gov/fentanyl-free to find the tools we discussed today. Again, we thank you, and we look forward to having you back with us in October.
Great.
Absolutely.
Thanks, Dee. It's been great being here. Thanks again.